So in this class, we'll talk about acute alcohol intoxication. We'll start off with intoxication of alcohol, then we'll move into insulin. Then we'll go look over what is vaccines and vitamins if possible as well. Now coming to alcohol intoxication, specifically acute alcohol intoxication, this is occurring in a condition where the patient is taking a lot of alcohol in a very short period of time. Okay, especially hard alcohol. Now, if someone consumes a large quantity of alcohol in a very short period of time, there will be dangerous intoxication. Sometimes even in chronic alcoholics. So, as such, patients who are chronic alcoholics, meaning someone who has been drinking alcohol for a long period of time, you would expect that they might not have intoxication. But if they do consume a lot of alcohol suddenly at a very short period of time, that can lead to intoxication. This will mainly be manifested through your blood alcohol levels. Okay, intoxication signs will start becoming prominent once alcohol levels or serum alcohol levels reach around 200 mg percent. Okay, whenever it is reaching 200 and above, that is when it is starting to cause intoxication. Now, alcohol concentration will become fatal, or the alcohol intoxication will become fatal if this concentration goes up to 500 to 800. At that point of time, it is very hard to revive the patient back or to bring the patient back. Okay, somewhere between 500 to 800 patients, there's a very good chance that the patient will die. Okay, it will specifically be apparent by CNS symptoms. What happens is if someone is having alcohol intoxication, severe alcohol intoxication, they will have CNS depression. They might have severe drowsiness, stupor, pupils will become dilated, their speech will become slurry. Okay, they'll have nausea, vomiting, tachycardia. Their reflexes will not work anymore properly, will not be able to walk properly. Hypotension occurs, circulatory system will collapse. Okay, uh, yes, what you call blood pressure will significantly decrease, because of which circulatory collapse occurs. The patient will have hypothermia, ठीक है, to an extent where you will have to put on a lot of blankets on the patient. Okay, आपका सर्कुलेशन लेवल कम हो जाता, the patient might even go into coma. ठीक है, death is can occur but it is uncommon due to ethyl alcohol. मेथनॉल से डेथ हो सकता, एथेनॉल से होना थोड़ा अनकॉमन है. ठीक है, there will be a lot of problems, no doubt, but generally it will not cause death. Methanol will cause death. Now you treat it with stomach wash. Okay, mainly ethyl alcohol जो है, आप alcohol intoxication को normal saline से stomach wash करते. You make sure that you maintain circulation and respiration of the patient, because circulation and respiration generally tends to get depressed with alcohol ingestion. Try to maintain that. You can give glucose, 50 ml of 50% glucose solution. You can give it as IV, especially to treat hypoglycemia. You can give B1, vitamin B1, 100 mg of thiamine. Okay, ये इसलिए देते हैं आप क्योंकि patients who have alcohol intoxication, they will have a special type of encephalopathy called Wernicke's encephalopathy. वो avoid करने के लिए आप विटामिन B1 का डोज देते हैं 100 mg का. Okay, make sure that you are maintaining fluid and electrolyte balance. Right, this also ties into maintaining circulation in a way, because there is circulatory collapse. You have to make sure that circulation is working properly, and if possible, perform hemodialysis as soon as possible so that you can clear ethanol out of the patient's body as soon as possible. Okay, that is about acute alcohol intoxication. Now coming to insulin. अब इंसुलिन जो है, insulin का overdose mostly is accidental. This is occurring when the patient is taking more than normal dose. Patient is diabetic and they are consuming more than normal dose of insulin. That is when they will start having these complications: overdose of insulin, hypoglycemia, profound hypoglycemia because of excessive insulin. The patient will start sweating a lot, palpitations occur, tremors occur. They will not be able to see properly, blurred vision occurs. There'll be a lot of weakness, hunger, confusion. They'll not be able to concentrate properly. The patient might become drowsy. Okay, in certain conditions what happens is the patient will start showing tachycardia. convulsions, sometimes even death occurs. Coma will follow death अगर बहुत overdosage हो गया insulin का, leading to significant hypoglycemia. At that time, coma and death can occur. Now, in patients who have cardiovascular problems along with diabetes mellitus, if you remember when we were discussing about beta blockers, I told you never give beta blocker along with insulin, because what happens is अब समझो hypoglycemia हो रहा, by chance the patient has consumed a larger dose of insulin than required, because of which hypoglycemia is occurring. Hypoglycemia का एक बहुत common symptom is tachycardia. If you are giving the patient beta blocker, you will not be able to see that tachycardia, meaning you will not be able to diagnose hypoglycemia properly. In the sense, you will not be able to diagnose insulin overdose as well. Okay, so it can be problematic in that condition. That is why beta blockers are generally avoided with insulin. If you do have an individual who is having insulin overdosage and hypoglycemia, profound hypoglycemia, you can give oral glucose, ठीक है, ट्रीटमेंट के लिए, या फिर आप ऑरेंज जूस दे सकते हैं. यू कैन गिव एनी अदर फ्रूट जूस एज वेल. ठीक है, orange juice generally gets absorbed very easily. You can give any other juice, for any other fruit juice for that matter. In severe cases, glucose is generally given IV. Okay, 50 ml of glucose is infused into given to the patient intravenously. 50% of 50 ml glucose. Okay, 50 ml, 50% glucose. One second, IV. Okay, in severe cases. You can follow this up by dextrose infusion till the patient's glycemic level becomes normal. Okay, and you're making sure that insulin overdosage ka jo symptoms hai, those are abating down. Then there is, see, normally people tell give chocolate and all as well, but chocolate takes some time to get absorbed. You can give in case there is nothing else, but if possible, try to give them fruit juice. Even if you find someone who you know who is undergoing hypoglycemia, even if it's not because of insulin overdosage, if they have severe hypoglycemia, try to give them fruit juice. Okay, gets absorbed very quickly. Then coming to iron overdosage and iron intoxication or acute iron poisoning for that matter, this is more common in infants. ठीक है, infants में बहुत common रहता है ये. This is specifically because they are not able to metabolize iron properly. ठीक है, आप जब iron देते हैं, especially अगर समझो you are giving iron supplements to a child. Okay, uh, if you give a slightly significantly high dose, in that condition what happens is iron overdose will occur, specifically because they are not able to process that iron in their body, and it will be manifested with abdominal pain, hematemesis. They will start vomiting blood. The patient will have severe abdominal pain, vomiting, bloody vomiting, bloody diarrhea. They will undergo cyanosis, acidosis. Okay, acidosis is one condition that occurs in iron which you need to treat promptly. Okay, acidosis की वजह से the respiration will also start getting affected. Cardiovascular system collapses. They might go into coma. Iron overload is very important to treat in time because death may occur within 6 to 12 hours. Okay, if not treated in time, 6 to 12 hours में the patient might die. ठीक है, so diagnosis, immediate diagnosis and treatment are very important. इसकी treatment के लिए you will give gastric lavage. You will perform gastric lavage. Okay, so you'll put a tube down the patient's vertical stomach, and you'll essentially perform the lavage. Generally you'll perform this lavage using sodium bicarbonate. 2% sodium bicarbonate से आप gastric lavage perform करते हैं. Okay, there is one specific antidote for iron poisoning called desferoxamine. Okay, desferoxamine क्या करते हैं आप, you will give it as a 5 to 10 mg, 5 to 10 grams tablet after you have given what you call after the stomach wash or after the gastric lavage. This desferoxamine, फेरोक्सामाइन, ठीक है, This fellow makes sure that whatever iron that is left off in the patient's body, that is not getting absorbed. Now you will try to remove as much as possible through stomach wash or gastric lavage, but still there be some iron left. Desferoxamine helps in making sure that the leftover iron that is present inside the body is not getting absorbed into the body. Okay, as long as it is not absorbed into systemic circulation, it is not that big of a problem. It will be excreted out of the body. But agar absorb हो रहा, then it will be a bigger problem. In some cases desferoxamine oral देने के बजाय you can give intramuscularly as well. ठीक है, 2 grams intramuscularly 2 times a day you can give, या आप IV भी दे सकते हैं 10 to 15 mg per kg. ठीक है, every hour. Make sure that you're correcting acidosis and shock. Okay, shock will also occur in iron poisoning, so make sure that you correct that. Hemodialysis can be performed. Hemodialysis कर सकते हैं आप, या exchange transfusion कर सकते हैं. If there is severe anemia, severe iron overload, if there is severe intoxication, in that condition you can perform hemodialysis. All right. So with that, we have completed poisoning, the different type of poisoning. In this, the most significant ones for you in your this thing vertical portion will be क्या बोलते हैं ये, organophosphorus poisoning. Okay, the one that we discussed in क्या है आपका cholinergics. Okay, now coming to vaccines and anti-sera. ये क्या है? First of all, we can primarily divide vaccines and anti-sera as active immunity or active immunization and passive immunization. Vaccines are a part of active immunization. Active immunization में आप क्या कर रहे हैं? Let's suppose there is a bacteria. Okay, let's suppose there is this bacteria, and this bacteria has several components on its cell structure. ठीक है, proteins they are doing flagellae or whatever they are, different proteins that will do different functions. For a human, these organic structures of this particular bacteria will act as an antigen. Okay, for a human, this is an antigen. इसका मतलब ये है this antigen can trigger an immune reaction. This is a component of the bacteria or of the pathogen that can trigger an immune reaction. अब आप क्या कर रहे हैं एक्टिव इम्यूनिटी में? You are administering the antigen of that bacteria into the host. So let's suppose I have a child of 5 years old. ठीक है, now उनके अंदर before this what you call child gets infected by this particular bacteria, let's suppose this bacteria's name is A. ठीक है, before it gets infected with A, what I will do is I will take one part of that bacteria which is the antigen, and I will induce it into the child. ठीक है, only that antigen. This antigen is basically induced into the or given to that boy, so that or boy or girl or the child, so that the patient will start producing antibodies. Up actively, you are making sure that the boy or the child is developing antibodies, they are developing immunity through exposing them to antigens. Okay, generally you will get vaccines as suspensions of microorganisms. They will be dead organism, या फिर it can be live attenuated organism. Dead organism, as the name suggests, the organism is dead, only the antigen will be present. That antigen आपकी बॉडी उसको रिकॉग्नाइज करके एंटीबॉडी फॉर्म कर लेती, एंड दे विल बी स्टोर्ड एज memory cells. Later on down the line, if at some point or the other, if the patient is getting infected by that same bacteria or virus, what will happen is your memory cells will kick in and antibodies are produced at a much more faster pace. Generally antibody production takes time. First infection jab hota, your body will not have enough amount of time to adapt. That is why first infection will be a little more severe. इसलिए बच्चों को बार बार तबीयत खराब भी होती है, and they get infected very easily as well. Okay, as you get older and as you start getting more and more acclimatized to several infections, what will happen is your body will start getting used to infections and it will start developing immunity. This is something that you are doing with vaccines. Okay, you are instead of waiting for a bacteria to infect the person, you yourself are giving a inactive form of the bacteria. You are either giving a dead bacteria or dead pathogen, or you are giving a live attenuated microorganism. Live attenuated का मतलब यह है, live attenuated, लाइव अटेन्यूएटेड का मतलब ये है दैट माइक्रो ऑर्गेनिज्म इज अलाइव बट इट हैज लॉस्ट इट्स विरुलेंस, इट कैन नॉट कॉज disease anymore. Okay, the proteins, or you basically genetically modify the microorganism in such a way that even though it is alive, it is not able to cause any infection or problem. That is live attenuated. ठीक है, you are removing its virulence, you are removing its capacity to cause disease. तो आप वो दे सकते हैं. The maximum that will happen is a slight fever that might occur in patients, in these children who are being vaccinated. That is why whenever, sometimes if you ever see a vaccinated child, they will start having a fever. Okay, maybe for a day or so they will have a slight fever. After that they'll get better. Okay, this is only in response to the antigen, and your body will start producing antibodies immediately. Okay, immunological defense will be mounted and antibodies will be developed, which can be later on used. Now vaccines are as such prophylactic. Okay, बहुत सारे अलग अलग types of vaccines आते हैं. You have BCG vaccines, specifically if you talk about, let's suppose, uh, क्या बोलते हैं, live attenuated type of vaccines, where I told you you will give a live microorganism which has lost its immunity, which has lost its function. Sorry, BCG vaccine use कर सकते हैं आप, या फिर that is a type of live attenuated, या typhoid vaccine. ठीक है, these are generally live attenuated vaccines. टॉक्सॉइड्स भी दे सकते हैं आप. टॉक्सॉइड्स एक अलग टाइप ऑफ वैक्सीन है जिसमें क्या कर रहे हैं आप, बैक्टीरियल एक्सोटॉक्सिन्स जो रहते हैं, those are modified. You will remove the toxicity out of that. It is also a type of antigen. Okay, what you do is you take one component of the bacteria, remove the toxicity from that antigen, meaning that antigen cannot cause disease anymore, and it will retain its antigenicity, meaning it will still be an antigen. It can trigger an immune reaction, but it cannot cause any toxicity. Those are called toxoids. Okay, इसको भी कभी वैक्सीन में यूज करते. सो टॉक्साइड का एग्जांपल इज योर टेटनस वैक्सीन. ठीक है, टेटनस वैक्सीन या डिफ्थीरिया वैक्सीन, बोथ ऑफ देम आर टॉक्साइड टाइप ऑफ वैक्सीन्स. देन यू हैव पैसिव इम्यूनाइजेशन. पैसिव इम्यूनाइजेशन में आप क्या कर रहे हैं, इंस्टेड ऑफ गिविंग द होस्ट एंटीजन सो दैट दे कैन डेवलप एंटीबॉडीज, यू आर गिविंग द एंटीबॉडीज इटसेल्फ. ठीक है, so अब vaccines में क्या कर रहे थे आप, you were taking one antigen from the bacteria, either you are giving the whole bacteria together altogether, or you are giving an antigen from the bacteria so that the person can develop antibodies in their body. पैसिव इम्यूनाइजेशन में आप क्या कर रहे हैं, यू आर गिविंग एंटीसीरा. ठीक है, एंटीसीरा या इम्यूनोग्लोबुलिन्स, दीज आर एंटीबॉडीज दैट आर ऑलरेडी प्रोड्यूस्ड इन सम अदर ऑर्गेनिज्म. आप क्या करते हैं जनरली इसमें, फॉर टेटनस या गैस गैंग्रीन या डिफ्थीरिया, रेबीज, उन लोगों के लिए सीरा रहता. सो व्हाट यू डू इज, लेट्स सपोज यू टेक अ हॉर्स. ठीक है, जनरली द हॉर्सेस आर यूज्ड. आप क्या करते हैं, हॉर्स के अंदर वैक्सीन दे देते. ओके, स्पेसिफिक वैक्सीन जो है एक्टिव इम्यूनाइजेशन के लिए, यू विल गिव अ वैक्सीन टू दैट हॉर्स. अब over time that horse will start developing immunoglobulins, right? They will start developing antibodies against those specific, what do you call, दो स्पेसिफिक ऑर्गेनिजम्स. फॉर एग्जाम्पल, अब आप समझो टेटनस की वैक्सीन जो है, यू गिव इट टू सम हॉर्स. Okay, and you waited for a few days for that horse to develop immunoglobulins and to develop antibodies against tetanus. Now what you will do is you will draw a little bit of blood from that horse, and you will separate immunoglobulins that were formed in the horse in response to tetanus. अब जो tetanus की इंजेक्शन दी है पहले हॉर्स के अंदर, बिकॉज ऑफ दैट यू आर एसेंशियली गिविंग एंटीजन. ठीक है, in response to antigen, antibody is formed in the horse. You are extracting blood, and from that blood you are extracting the antibodies. Antisera literally means you, antisera या immunoglobulins में क्या करते हैं आप, पेशेंट को instead of giving active antigen, you are giving the antibody that was developed from the horse. ठीक है, हॉर्स एंटीबॉडीज लेके आप इंजेक्ट करते पेशेंट को. This see, this is more like a booster kind of thing. And another problem with anti-sera is that allergic reactions can occur because it is not something that is occurring in your body. आप your organism से antibodies निकाल के patient को दे रहे. Because of which what happens is sometimes allergic reactions like serum sickness या anaphylaxis can occur with anti-sera. This will not be a problem with vaccines. ठीक है, immunoglobulin से भी ये problem नहीं होता, anti-sera से होता. क्योंकि यहाँ स्पेशली अगर वैक्सीन देखें तो those are antibodies that are formed in your own body. Okay, you are only inducing the antigen and antibodies are formed in the person's body. यहाँ पर आप क्या कर रहे हैं, एंटी सीरा में किसी और के एंटीबॉडीज लेके you are putting it into the patient. Okay, which is again it is not preferable. If possible, you have to give active and immunization. But if in case of emergency, if the patient is not vaccinated and treatment दे रहे हैं आप बट काम नहीं कर रहा, तो one of the things you can do is give anti sera. ठीक है. Then there will be primary and secondary immunization. Primary immunization mainly occurs in children. ठीक है. Primary immunization is from birth up to 12 years of age, 15 years of age, 18 years of age, जो आप time to time vaccines लेते, those are primary immunizations. Secondary immunization will generally occur in adults. ठीक है. So booster doses जो देते आप, एक बार vaccinate कर दिया, उसके बाद second time फिर vaccinate कर रहे हैं for the same organism as a booster dose, so that immunity is still maintained. Primary immunity is boosted in a way. Okay, that will be a booster dose and that will be secondary immunization. Now coming to vitamins, see, we'll discuss about vitamins with respect to therapy or with respect to pharmacology, in the sense that कहाँ पर indicate होते वो specifically. I'll give you some details about what those vitamins are and where you get the sources and all of that, what is their function. But mainly we'll look out for how they are treated and what they are treating. ठीक है. Now vitamins, as you know, are organic compounds. These are essential for normal metabolism of your body and you get them from food. Okay. Requirement is always there for vitamins, and it will specific the requirement for vitamins will specifically increase in special conditions, special physiological conditions like stages of growth. ठीक है, in growing children या फिर during pregnancy या lactation, वो time पे the requirement for vitamins will increase, and vitamin deficiencies will present themselves with specific type of symptoms. ठीक है, विटामिन स्पेसिफिक टाइप ऑफ सिम्टम्स, अब विटामिन ए की डेफिशिएंसी हुई तो उसके स्पेसिफिक सिम्टम्स दिखते हैं, एंड अकॉर्डिंगली अलग अलग विटामिन के अलग अलग सिम्टम्स दिखते हैं. Now coming to the first, you have two main categories in vitamins. You have fat soluble and you have water soluble vitamins. One second. Soluble. अब आपके फैट soluble vitamins में ADE क्या आता. Coming to the first one, vitamin A. This is present in your diet as you will find it as retinol, या फिर you will find them as carotenoids. ठीक है, carotenoids the pigment, or you can even find them as dihydroretinol. ठीक है, any of these forms. Carotenoids generally आपको दिखते green and yellow vegetables में. You can find vitamin A in green leafy vegetables, in carrots, mango, papaya, eggs, milk, a little bit in cheese, fish. फिश लिवर ऑयल्स जो रहता है उसमें विटामिन ए बहुत अच्छा रहता. देयर इज वन पर्टिकुलर फिश कॉल्ड halibut. Halibut has the highest amount of vitamin A amongst all sources, all natural sources of vitamin A. Specifically, halibut liver will have around 9 million milligrams, sorry, 9 lakh milligrams per 100 grams of liver. Okay, so that's a very, very high dose of vitamin A. Now, physiologically, vitamin A के जो functions है, one of the most important functions that vitamin A does is helps your eye adapt to changes in darkness. ठीक है, for example, it will help in adaptation of your vision to darkness. अब समझो आप light से dark में suddenly you enter into a dark room, there is a point where your eyes will adapt. ठीक है, आप initially you will not be able to see in a dark room, and eventually if you give it a little bit of time, within a few seconds you'll be able to see. That adaptiveness occurs because of vitamin A. Okay, it will play a very important role. If someone has deficiency of vitamin A, they will not be able to adapt at all, or it will take them a long time to adapt altogether, so their vision will not be as acute as well. Okay, it will not be as adaptive as well. Now, it is also responsible for synthesis of rhodopsin. Rhodopsin is a photosensitive pigment. It will be present in your rods. ठीक है, rods of your retina. आपके retina में rods and cones जो रहते हैं, rods में rhodopsin बोल के एक pigment रहता है, which is a photosensitive pigment. अगर rhodopsin पे light पड़ी तो your rods will get activated and you'll be able to see certain parts of vision. Okay, rods and cones will work together, wherein you'll be able to see the whole image in different colors. Okay. vitamin A also has a function where it is helping in maintaining integrity. Epithelial cells key, it is helping in growth. It is also helping in cell mediated immunity to a certain extent. So you can understand that vitamin A is very important. अगर vitamin A की deficiency हो रही, the patient will develop xerophthalmia. First thing that will happen is xerophthalmia, dryness of eyes. Okay. The patient will have spots on their conjunctiva, bitot spots बोलते हैं लोगों को. The patient might have night blindness. Night blindness का मतलब ये है they will not be able to see at all in darker environments. Okay. Especially a darker room or even after the sun goes down, at that time the patient will not be able to see after dusk. That is, the patient will have diarrhea. They might have dry and rough skin. Okay. Especially all of these are seen in early stages. Xerophthalmia या diarrhea, dry skin, rough skin, all of them. अगर later stages हो रहा तो cornea will start getting affected. Specifically later stages में केरेटोमलेशिया होता. केरेटोमलेशिया में क्या हो रहा आपके कॉर्निया जो है they will become cloudy. You'll not be able to see properly. There will be perforation of cornea. You might even have necrosis in your eye, or the patient will become blind. Okay, if prolonged vitamin A deficiency occurs, especially in the later stages. Now, as such, the daily requirement for vitamin A is around 3,000, 3 to 5,000 international units per day. Okay, that much about should be consumed every day for nice and healthy eyes. Specifically, if we talk how we are using it therapeutically, if you have a patient who is having vitamin E deficiency, आप prophylactically use कर सकते हैं, यही dose use कर सकते हैं, so that you avoid the development of vitamin A. What you can do is give the same dose. You give 3,000 to 5,000 international units of vitamin A per day. ठीक है, whenever there is slightly increased requirement as well. ठीक है, let's suppose the patient becomes pregnant. ठीक है, या फिर if it's a child who is showing few symptoms of vitamin A deficiency, उसमें आप दे सकते हैं. अगर आप specifically treat कर रहे हैं तो आप क्या कर सकते हैं, you can give 50,000 to 1 lakh international units. 50K to 1 lakh international units. Now, this you will give intramuscularly or you can give it orally, and this will be given once in 1 to 3 days. Okay, depending on the patient's condition, you will vary the dose a little bit. Especially अगर आप orally दे रहे हैं supplementation of vitamin A, तो 1 से 3 दिन के बीच में you have to switch, because you do not want to cause hypervitaminosis either. Hypervitaminosis will be bad as well. You do not want excessive amount of vitamin A. See, anything which is more in quantity than normal is also bad. It is not good. In certain cases, vitamin A can also be used for acne. Okay? It has been shown that acne के लिए it is helpful. Now, coming to vitamin K, vitamin K is something that is essential for synthesis of clotting factors. Very, very important for synthesis of clotting factors, specifically biosynthesis of prothrombin, for the synthesis of factor 7, factor 9, and factor 10. Okay, so it plays a very important role in clotting. Now, as such, you will find three different types of compounds of vitamin K. You will find K1, K2, and K3. K1 जो है, you will find it in plants. The food that you consume, green leafy vegetables and plants, उसमें आपको generally मिलता vitamin K1. K2 is produced in your gut. ठीक है, gut bacteria जो है, they are able to produce K2. K3 will be what you give therapeutically. अगर there is hypovitaminosis, whenever there is vitamin K deficiency, वो condition में आप vitamin K3 देते. Okay, that is the therapeutic dose of vitamin, the therapeutic form of vitamin K. Now you can find vitamin K in egg yolks, tomatoes, cheese, liver, meat. Generally, vitamin K deficiency rather uncommon है, because most of India, at least in Indians, because most of Indian diets will consume a lot of tomatoes. Okay, even if they are not consuming a lot of any other thing, even they have tomatoes, it is significantly rare. But again, you might find them in poorer people or in people who do not have access to good food. Okay, generally deficiency will be a result of liver diseases. डाइटरी डेफिशिएंसी के बजाय लिवर डिजीज से होना ये बहुत कॉमन है. Okay, liver disease या फिर malabsorption, they might be having some intestinal problems where absorption of vitamin K is not occurring properly. या फिर आप antibiotic therapy, you are giving antibiotic therapy for a long period of time because of which absorption of vitamin K is not occurring properly. Okay, very rarely it occurs because of dietary deficiency, and you will see vitamin K deficiency manifesting as bleeding problems. Okay, the patient will have problems in clotting properly. ठीक है, अगर एक बार हेमरेज हो रहा बोले तो क्लॉट formation will take a long period of time. One thing you need to remember with vitamin K is that whenever, as I told you earlier as well, whenever you are administering it as well, make sure that you do it very slowly. ठीक है, अगर आप IV भी दे रहे तो स्पेशली IVIM, make sure that you're doing it very slowly. आप विटामिन के कब यूज करते हैं, विटामिन के डेफिशिएंसी में यूज कर सकते हैं या न्यूबॉर्न बेबीज में यूज कर सकते हैं विटामिन के, बिकॉज दे विल नॉट हैव गट फ्लोरा. Vitamin K2, which is produced by your gut flora, because these babies do not have properly formed intestinal flora, they will have lower levels of prothrombin and other clotting factors, so bleeding can be a problem in these children, because of which what you do is you give vitamin K1 supplementation, okay, especially to newborn babies, so that you can avoid any hemorrhagic diseases. Okay, now we'll discuss about vitamin E and the other types of vitamins in the next class. Okay.